Hello and welcome to Pedia Talks, an educational channel for the mums and dads. The topic I have selected to discuss today is bedwetting. Bedwetting is also called nocturnal enuresis, where enuresis refers to involuntary passage of urine and nocturnal refers to nighttime. Before we talk about bedwetting, I would like to talk a little about how urinary control is attained in children. Urination in the young infants is reflexive and happens every 2 to 3 hours when the bladder is full. By the time the child is 15 to 18 months old, he becomes aware of his full bladder and may start pulling at his wet pants. By 2 to 3 years, they have complete control over urination during the awake hours, although they may wet the bed during sleep. By the time they are 4 to 5 years of age, they achieve nighttime control too. A detailed discussion of this has been done in my video on toilet training, the link to which I will leave at the end of this lecture. What is bedwetting? Involuntary passage of urine during sleep is called bedwetting. This may happen during nighttime or daytime naps as well. As discussed previously, this is considered a normal maturational phenomenon till the child is 5 years of age. Bedwetting beyond this age may require evaluation. Now there are two types of bedwetting, the primary bedwetting and the secondary bedwetting. Primary bedwetting is when the child never achieved voluntary control during sleep, although they had adequate daytime control. In the secondary variety, a child who was having control over the urination at night earlier has recently started bedwetting. Now, why does secondary bedwetting happen? Most of the time, secondary bedwetting has a cause which needs to be investigated. These may be emotional stressors causing an upheaval in the child's life. For example, death of a loved one, birth of a sibling, maladjustment at home or school, anxiety, abuse, etc. Certain illnesses like a urinary infection, juvenile diabetes, and some renal conditions need to be ruled out. During this lecture, however, I will be focusing only on primary bedwetting, which is mostly a maturational problem and generally no organic cause is apparent. Now, why does primary bedwetting happen? These children may be deep sleepers, so that the signal from a full bladder fails to wake them up, although during awake periods they have full control. There may be some hormonal effect which may be increasing the urine production at night. They may be having small and tight bladder which doesn't distend well, hence the urinary frequency is high and they tend to pass urine in bed. We know this is the case when during daytime too they go very frequently for urination, say more than 8 times a day or every 2 to 3 hours. Genetic factors have a role to play. A family history of bedwetting in the parent or other siblings may be present. There may be a maturational delay of the brain's control over bladder activity, and it's also seen more common in children where toilet training has been delayed. Now, when should you seek medical attention? So, pediatric evaluation is necessary in all cases of secondary bedwetting, whatever the age, and in primary bedwetting, which is persisting after 5 years of age, in order to rule out any contributory medical condition. How do you manage? More important is the behavioral management. If that fails, we may need to resort to medication. So what is the behavioral management in this case? Once the medical evaluation finds no underlying illness, be reassured that the child will grow out of it. But even then, proper management needs to be done as it can have psychosocial consequences on the child. Child must be included in the behavioral management, and that will never be a problem as the child too doesn't like to wet the bed and is as keen as you are to be dry. Maintain a daily diary of bedwetting events. Make the child enter the dry nights and give themselves a red star for them. Child needs utmost emotional support from you, and chiding, scolding, making fun or taunting them is a big no and may be counterproductive. As parents, it is understandable that you will be cranky, waking up at night, changing bed sheets, etc., but try to do so without making much of a fuss. Encourage your child to sleep early and have a regular bedtime. Avoid fluids like cola, tea, coffee, milk, etc. at least 3 hours prior to bedtime. Just some water with dinner may be given. Give unrestricted fluids during daytime so that there is no dehydration. Encourage the child to void just before sleeping. About 2 to 3 hours after the child has slept off or whenever the parents are going to sleep, awaken the child once and make him walk to the toilet for voiding. Alternatively, an alarm may be set for waking the child up. Especially in those cases where the reason for bedwetting is a small bladder capacity, asking the child to withhold urination for as much time as possible should be encouraged. Another exercise can be starting and stopping the urinary stream during voiding. These exercises increase the elasticity of the bladder wall, thereby increasing its retention capacity. There are enuresis alarms available, which are specialized alarms where the sensor is placed on the pants, and as soon as it comes in contact with the wetness, the alarm gets triggered. So when do you resort to the medications? These are indicated either when the behavioral management has failed or child is older, say more than 6 to 7 years of age, and is facing a lot of anxiety due to the bedwetting. For example, they may be unable to go to a friend's sleepover or for a family or school excursion, etc. Medications are available in tablet or nasal spray form, but they should only be taken as per prescription from your pediatrician and never over the counter, else they may cause more harm than good. Thank you and happy parenting. If you find value in my video, please like and share it and subscribe to my channel Pedia Talks. See you in the next video.